ಆರೋಗ್ಯ ಕ್ಷೇತ್ರದಲ್ಲಿ ಮೈಲಿಗಲ್ಲು ಸಾಧಿಸಿದ ಉಡುಪಿಯ ಕಸ್ತೂರ್ಬಾ ಆಸ್ಪತ್ರೆ ಮಣಿಪಾಲದಲ್ಲಿ ಸುಧಾರಿತ ರೋಬೋಟಿಕ್ ಸರ್ಜರಿ ಸೌಲಭ್ಯವನ್ನು ಉದ್ಘಾಟಿಸಲಾಯಿತು. ಈ ಅತ್ಯಾಧುನಿಕ ತಂತ್ರಜ್ಞಾನದ ಸೌಲಭ್ಯವನ್ನು ಕಾರ್ಯಕ್ರಮದ ಮುಖ್ಯ ಅತಿಥಿಯಾಗಿದ್ದ ಒಲಿಂಪಿಕ್ ಬ್ಯಾಡ್ಮಿಂಟನ್ ಚಾಂಪಿಯನ್ ಸೈನಾ ನೆಹ್ವಾಲ್ ಅನಾವರಣಗೊಳಿಸಿದರು. ಆಂಕಾಲಜಿ, ಸಾಮಾನ್ಯ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ, ಜಿಐ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ, ಒಬಿಜಿ, ಮೂತ್ರಶಾಸ್ತ್ರ ಮತ್ತು ಮೊಣಕಾಲು ಹಾಗೂ ಕೀಲು ಬದಲಿ ಕಾರ್ಯವಿಧಾನಗಳಲ್ಲಿ ನಿಖರತೆಯನ್ನು ಹೆಚ್ಚಿಸುವ ಮತ್ತು ಫಲಿತಾಂಶಗಳನ್ನು ಸುಧಾರಿಸುವ ಗುರಿಯನ್ನು ಹೊಂದಿರುವ ಈ ಸುಧಾರಿತ ತಂತ್ರಜ್ಞಾನವು ರೋಗಿಗಳ ಆರೈಕೆಯಲ್ಲಿ ಹೊಸ ಕ್ರಾಂತಿಯನ್ನುಂಟು ಮಾಡಲಿದೆ. ಮಣಿಪಾಲ ಕ್ಲಸ್ಟರ್ನ ಸಿಒಒ ಡಾಕ್ಟರ್ ಸುಧಾಕರ್ ಕಂಟಿಪುಡಿ ಅವರು ಕಸ್ತೂರ್ಬಾ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ರೋಬೋಟಿಕ್ ಶಸ್ತ್ರಚಿಕಿತ್ಸಾ ಸೌಲಭ್ಯದ ಕುರಿತು ಪ್ರಾಸ್ತಾವಿಕವಾಗಿ ಮಾತನಾಡಿದರು. ಕ್ಯಾನ್ಸರ್ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯಲ್ಲಿ ರೋಬೋಟಿಕ್ನ ಅವಲೋಕನವನ್ನು ಸರ್ಜಿಕಲ್ ಆಂಕಾಲಜಿ ವಿಭಾಗದ ಪ್ರಾಧ್ಯಾಪಕರು ಮತ್ತು ಮುಖ್ಯಸ್ಥರಾದ ಡಾಕ್ಟರ್ ನವೀನ್ ಕುಮಾರ್ ಎಎನ್ ಅವರು ನೀಡಿದರು. ಸಂಪೂರ್ಣ ಕೀಲು ಮತ್ತು ಮೊಣಕಾಲು ಬದಲಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯಲ್ಲಿ ರೋಬೋಟಿಕ್ಸ್ ಕುರಿತು ಮಾಹಿತಿ ಮಣಿಪಾಲದ ಸಹಕುಲಪತಿ ಡಾಕ್ಟರ್ ಶರತ್ ಕೆ ರಾವ್ ನೀಡಿದರು. ಮಾಹೆ ಮಣಿಪಾಲದ ಸಹಕುಲಾಧಿಪತಿ ಡಾಕ್ಟರ್ ಎಚ್ಎಸ್ ಬಲ್ಲಾಳ್ ಅಧ್ಯಕ್ಷೀಯ ಭಾಷಣವನ್ನು ಮಾಡಿದರು. ರೋಬೋಟಿಕ್ಸ್ ಸೌಲಭ್ಯ ಉದ್ಘಾಟಿಸಿದ ಸೈನಾ ನೆಹ್ವಾಲ್ ಶುಭವನ್ನು ಹಾರೈಸಿದರು. ಮಾಹೆ ಮಣಿಪಾಲದ ಸಹಕುಲಾಧಿಪತಿ ಡಾಕ್ಟರ್ ಎಚ್ಎಸ್ ಬಲ್ಲಾಳ್ ಅಧ್ಯಕ್ಷತೆಯಲ್ಲಿ ನಡೆದ ಉದ್ಘಾಟನಾ ಸಮಾರಂಭದಲ್ಲಿ ಮಣಿಪಾಲ ಕ್ಲಸ್ಟರ್ನ ಸಿಒಒ ಡಾಕ್ಟರ್ ಸುಧಾಕರ್ ಕಂಟಿಪುಡಿ, ಕಸ್ತೂರ್ಬಾ ಆಸ್ಪತ್ರೆ ಮಣಿಪಾಲದ ವೈದ್ಯಕೀಯ ಅಧೀಕ್ಷಕ ಡಾಕ್ಟರ್ ಅವಿನಾಶ್ ಶೆಟ್ಟಿ ಮತ್ತು ಮಣಿಪಾಲ ಆಸ್ಪತ್ರೆಗಳ ಮಂಗಳೂರಿನ ಪ್ರಾದೇಶಿಕ ಮುಖ್ಯ ಅಧಿಕಾರಿ ಶ್ರೀ ಸಖಿ ಸಿದ್ದಿಕಿ ಸೇರಿದಂತೆ ಗಣ್ಯ ಅತಿಥಿಗಳು ಉಪಸ್ಥಿತರಿದ್ದರು.
I found the campus really beautiful, really nice, and in fact my physio, I was with him from last 20 years. He's also come out of Manipal University. His name is Kiran Chalamunda. So he should keep telling me what a beautiful university, you should go and visit and go there and have a look. And today I think it was this time in some way that I had to be here. I saw the campus, really nice, saw the sports facilities. I still have to go there, but I briefly saw it and it's, I think, really, really nice. As sports person, we face a lot of injuries. We hate injuries, but that's what we like, coming out of it and becoming champion again, winning again. That's the attitude a sports person, obviously at the highest level, is got. Everyone is mad for winning, so they don't mind coming out of surgeries or any kind of injuries and waiting for their time to, when they get fully fit again and start playing again. So definitely the trainers, physios and doctors play a huge role in our recoveries and getting us back into very good shape. And today when I saw this equipment, robotic equipment, which is really, really nice for the recovery, and when Sudhakar sir was telling me that in the morning he was giving me an example that they got, I think, 89-year-old patient done the surgery with, and he was okay the next day and he was able to walk. I think this is really, really nice, which even the sports persons look forward to. We have to obviously go through that process of getting our muscles back to that stage where we can play at that level, but it will be really great, sir, if we can walk the next day and go back to our houses and start rehab and getting back to the court fast. But yeah, after the surgeries, it takes us almost like we are in the plaster for like 4-5 weeks and then rehab and then coming back. So obviously it's a process, it's a tough process. You have to be mentally strong. But I think this new innovation is really going to help a lot of athletes, a lot of normal people out there. But personally, as a sports person, I think I would want to stay away from the surgery as much as possible, because it's always nice to go to the physio and do good exercises and be ready for the tough time. Of course, you won't have the issues till 40, 45, but after that, I can see my parents both.
We all know that aging is a process where your muscle mass, bone mass, including the brain volume, goes on coming down as we age. The same thing happens to the knee joint also. Knee joint is, after all, a joint for the smooth movement. There is a coverage of cartilage. As the aging advances, this cartilage, the smooth surface of the cartilage starts eroding.
All you know that treatment of cancer has evolved over in decades, maybe 2 to 3 decades. It has been evolving very fast. And minimally invasive surgery, it is the integral part of our cancer surgery. Minimally invasive surgery is the what you call as the keyhole surgery. It has become integral part of our cancer surgical management from last 2 decades. So MIS or minimally invasive has started with laparoscopy. It is used for keyhole surgery for tummy, or thoracoscopy surgery. It's been used for a thorax to address the chest tumor or inside the thoracic cavity tumors. So it's become integral part since last 2 decades in thoracic in terms of lung cancer surgeries, or thymectomies or thymus tumors, mediastinal tumors. In terms of abdomen, it could be from the gastrointestinal tract surgeries, hepatobiliary pancreatic surgeries, and gynecological surgeries are one of the most commonest area where it's become standard. It was the one of the subside just become standardized as early as in 20 years back, and the urological cancer surgeries.
Today marks a historic milestone in the journey of Kasturba Hospital, Manipal. The Center of Excellence for Robotics represents not just technological advancement, but a commitment to precision, safety, and patient care. With the state-of-the-art platforms like Hugo, Medtronic Robo, and Mako Striker, we are ushering in a new era of robotic-assisted surgery. One that enhances surgical accuracy, almost very less blood loss, and the ALOS dramatically comes down with this.
Now this robotic, the excellence, the details of all that, Sharat Rao, an orthopedic surgeon of great repute, and also Kiran Acharya is here, the head of the department of orthopedics. Illa, wherever Nodli is here, because we have visited the site of these facilities, orthopedic facilities, and Kiran Acharya and Sharat explained to Sania about the facilities, how the robot is helpful in improving the facility of orthopedic surgery, which is very important for Sania because they invariably sustain these ligament tear, cartilage tear, etc., which she has already mentioned. And then cancer facilities, Naveen Kumar has already explained to you the facility, and also Prasad, our head of the department. Prasad, just rise, man, so that others can see you. The surgery, how useful it is in helping the patient with minimal invasion. That is very important, and also recovery is very fast. That's the reason why we have. And Kasturba Medical College, Sania, is, as Sharat Rao told you in the presentation, 29th first self-financing private medical college to be started in this country in 1953. And ours was the 29th medical college. Today we have more than 700 medical colleges in this country. I'm happy and proud to say that we are consistently ranked within the top 10. I always say reaching the top is difficult, but to remain in that position is still more difficult. Which we are able to hold on. Basically, we feel it is because of the quality of the faculty and the students. Because in Manipal, there is no other criteria for admission of the students or selection of the faculty other than merit. Merit and merit only. Because we strongly feel the quality of the students and faculty are responsible for the quality of the institution or reputation of the institution, rather than the infrastructure, bricks and mortars. It is necessary, but more important than that is the quality of the faculty. That's why We call Kasturba Medical College as the flagship of our university. We have 25 institutions. We are a multidisciplinary university, of which KMC